One of the most common ovulatory problems is where a female just doesn't ovulate on the 14th day or around that day. She may ovulate maybe day 30 or 40 or 50, and that's called ovulatory dysfunction. One of the most common reasons for ovulatory dysfunction is called Polycystic Ovarian Syndrome, or PCO. Some people call it PCOS or PCOD, which is polycystic ovarian disease. It's really not a disease, it's more of a syndrome where the egg is just not released on time. PCOS probably affects 2 to 3 women out of 10 in the reproductive age. And we're seeing a large increase in PCOS type patients because of the increase in obesity in this country. So weight gain has a lot to do with PCOS, and the patient really needs to be evaluated as far as thyroid disease, pituitary disorders, insulin resistance, fasting blood sugar, to give a real good total picture whether or not this patient has an underlying endocrine abnormality which is causing it. Now, there are a fair amount of women that have PCOS that only have a couple of the signs and symptoms. Usually these women are overweight, they have excessive hair growth or acne, and they don't get regular menstrual cycles. And if you do an ultrasound and you look at their ovaries, they have multiple little follicles with eggs in them that never went through the maturation or release of those eggs.
Now, as I discussed, the polycystic ovary is one that has multiple follicles in it that never went through the maturation phase like we see up here. You see here an egg is in a little bubble called a follicle, and that little follicle then gets larger and larger and larger until the egg is released. And that usually takes about 2 weeks to occur. With a PCO patient, these follicles start to grow and they kind of fizzle out between these two sizes. And that's why you see here this accumulation of all these follicles with eggs in them that just never finished their maturation phase or went through the whole growth phase and releasing an egg. And then what happens, these follicles that are remaining here begin to produce excess androgens, which are male-like hormones, and that's what causes the hair growth on the face and body, and sometimes male pattern hair loss in the on the top of the head, and even acne in these patients.
It's very easily corrected, and it depends on what the patient wants to do. Is she trying to get pregnant? Then we need to make her ovulate. If she's not trying to get pregnant, she really needs to be on something to keep those male hormone levels low, and the most common treatment would be go on a birth control pill. And those will really help with all those bad side effects women have that have PCOS, facial hair and acne. Weight loss also will help quite a bit. Women that have PCOS tend to gain weight easier than women that do not have PCOS because they have an insulin resistance problem. So when they eat foods that like are sugary foods or carbs, breads, pasta, rice, sugary drinks, they have a problem metabolizing that sugar, and they end up storing a lot of this sugar or glucose in a form of fat. So women really need to understand what PCOS is and how it affects them with their diet so that they can modify their diet, because if they know what to eat and they know how to do it correctly, they actually can lose weight easier than a regular patient. But then again, if they don't know what they're doing, they can gain weight a lot faster than your normal patient. So PCOS really needs a good evaluation. And as I said, it's so common. 2 out of 10 women, maybe 3 out of 10 women have some form of it. So you need really 2 of the 3 criteria, which are 1, irregular periods, 2, on ultrasound, their ovaries should have a lot of little follicles or a little tiny cyst, or 3, they have either some form of excess or some form or presentation of excess androgens, which are male hormones, which is hair growth and acne. So any 2 of those 3, they have PCOS.